Nursing homes and residential care facilities make up more than half of North Carolina's more than 600 coronavirus deaths. And late this afternoon, the state announced a plan to try and test every person who lives in or works at one of those facilities. Thanks for joining us. I'm Scott Wickersham.
I'm Erica Bryant. It's an update to the state's testing guidance. And just hours ago, the health department announced everyone who lives or has regular contact with high-risk places like nursing homes should have access to testing regardless of their symptoms. Now, we've been tracking outbreaks at nursing homes across the Charlotte area, and today, Cabarrus health officials were at Universal Healthcare in Concord testing the staff and residents there. Channel 9's Mark Becker was there also, and he is joining us now live. Mark, I know you talked to some of the workers. What did they tell you?
Well, as you might imagine, Erica, they're a little nervous, a little afraid, right? As are workers in other facilities I've spoken with over the last several weeks around the state. And certainly here in Cabarrus County, the county's Health Alliance is stepping up testing to help try and control that virus. The latest outbreak here in Cabarrus County is at Universal Healthcare in Concord, where a staffer and 3 residents have tested positive for the virus.
They are currently isolated. Our staff have the appropriate PPE, particularly our N95 masks, to take care of those residents, and they're doing just fine.
Spokesman Steve Curley told us the Cabarrus Health Alliance came today to test all of the other residents here. In Mint Hill this morning, Medic was helping Mecklenburg County's health department test all of the residents at the Mint Hill Senior Living Facility after there was a problem with tests that a private lab had done there on Monday. The tests come after the White House ordered nursing homes and rest homes to test all of their residents, even if only one person tests positive. In North Carolina, almost 60% of the deaths from COVID-19 have come in long-term care facilities, and the fear is real.
So I'm very worried, because like I was saying, my family member takes care of our elderly grandmother, my elderly grandmother, and she has kidney disease.
This woman, who didn't want us to use her name, told us she has 3 family members who work in nursing homes, including one at Universal Healthcare here in Concord. And Steve Curley says the testing here today is part of their mission to limit exposure to the virus here and in 14 other homes they own around the state.
We believe in close contacts with the local health department. We believe in being upfront, very transparent with what we have in our facilities, what we don't have in our facilities.
Well, and so certainly they're taking a more aggressive approach here and around the state, and we're told it should take about 36 hours to turn those tests around, so they should have some answers here, Erica, in about a day and a half.
All right, and I know you'll keep us updated. Thank you, Mark. We have been reporting on one nursing home in particular. The Citadel in Salisbury has the highest number of confirmed cases in the state. A husband and wife were among the 18 people who died at that facility. And today their family told Channel 9 that they were never told that either of them had the virus.
I'm so angry with Citadel. I'm angry. They did not do what they were supposed to do.
Wow, just a heartbreaking story. And we are digging deeper into their perspective tonight at 6 o'clock with the story of a couple of 30 years who died within just weeks of one another.
Well, you can see how dangerous the virus is, of course, for the elderly. But tonight, parents in the Charlotte area, of course, are worried about that new disease they're hearing about, possibly maybe linked to the COVID-19.
I think we all just need to be aware that this is something that's developing, to have a high suspicion if someone is having a persistent fever.
The disease has already claimed the lives of several children in New York, but so far doctors here in Charlotte say they have not seen any cases locally. Channel 9's Phil Orban spoke to an expert who said that while it's not here yet, there's just too much we don't know about it. Phil?
Yeah, there's just a single known case that has some of the parameters of this illness in Mecklenburg County, but experts agree we'll almost certainly see it at some point. So staying prepared and vigilant is critical.
Probably the most important thing is that we all maintain a high index of suspicion so we don't miss something and assume it's something less serious.
Dr. David Olmstead is a pediatric cardiologist at Novant Health who's been tracking this disease that's similar to Kawasaki disease, an illness the medical community has been familiar with since the 70s, where a prolonged fever and rash can evolve into a multi-system inflammatory disease targeting young children, toddlers, or pre-kindergartners. This new disease has similar markers but key differences.
It can be involving older children. It can be involved school age up through high school age children. They're describing significant abdominal pain, vomiting, but what is consistent is the fever and the rash.
Even though we're seeing a spike in cases at the same time as the coronavirus pandemic, Dr. Olmstead said it's too early to say one is dependent on the other. In some cases, the child is COVID positive. In others, the patient initially tests negative for the disease, only to test positive later for antibodies. And about 1 in 5 cases haven't been connected to COVID-19 at all.
Why we're seeing those, we don't fully understand. And bottom line, it's an unknown at this point.
Yeah, doctors say this isn't a disease that can spread. It's reactionary. It's not contagious. So something like COVID-19 can bring on this syndrome, but so too can other illnesses. And with so many unknowns about this disease, doctors are urging parents to be aware of and on the lookout for these symptoms. Scott, back to you.
Yeah, Phil, just one more thing to put mom and dad on heightened alert at this time. Appreciate that report. And as he mentioned, the symptoms are like Kawasaki disease: persistent fever, inflammation, poor function in one or more organs, and other symptoms similar to being in shock. Mecklenburg County is asking local healthcare providers to fill out a form if they do see a case like this. That would then go to the state so the state leaders can try to track the disease. New York City alone has 110 cases of it. Right now, the children who have died are all in New York City.
Cases in North Carolina are still rising of coronavirus, but the percent of positive tests continues to trend down. Right now, there are more than 17,000 cases in the state, and 641 people have died. South Carolina now reporting more than 8,400 cases and 380 lives lost. That is up more than 200 cases over the past 24 hours. This is the second day in a row that deaths there have increased by 9. Now, while we see those case numbers every day, it's even more important to check on people who've recovered. Also, we have a special one to tell you about today.
I'm hoping that she'll remember me. It's really hard.
That's Tracy Smith from 2 weeks ago. We reported that his mother, Elizabeth, had the virus. She was one of 72 cases from Monroe Rehabilitation Center. And as a dementia patient, she had to fight it all alone in the hospital. But now, weeks later, look at this. The 84-year-old has recovered. And these are some of the pictures that he shared with us of his mom now that she is feeling so much better. So happy to hear that. And thankfully, she is not alone. The data that we just got today from Mecklenburg County shows 1,400 people have recovered, and that is 62% of the county's 2,200 cases.
In a few hours, a big vote in Congress. It could give you thousands of more dollars in stimulus money. Want to bring in Channel 9's Washington correspondent Blair Miller tonight. And Blair, this bill will pass tonight, but you're saying that is actually not the real hurdle here.
Exactly, Scott. Don't get too focused on tonight because this is a Democratic bill going through a Democrat-controlled House. So it will pass tonight. We're hearing that vote should take place around 8 or 9 o'clock tonight, but then it goes to the Republican-controlled Senate. And senators are already telling me they won't even listen to this because it has too many things in there that have nothing to do with helping people with the coronavirus. Republicans want to see how the previous stimulus packages have worked before deciding on any more relief money. Scott?
All right, Blair, so while we talk about this one, again, voting on tonight, talk about other plans that are out there, other options people might have at getting stimulus money, say if this one doesn't happen.
Yeah, there's certainly a lot of ideas out there, Scott. The president has said all along he would like to see a payroll tax cut, and I think that may be the leading option for many Republicans. Right now, essentially, you'd be keeping more of the money from your paycheck if this were to happen. It wouldn't go to places like Social Security, but the Democrats don't really like that plan because it doesn't help people who are out of work right now, not bringing home a paycheck. Scott?
Yeah, people who need it the most. All right, our Blair Miller, thanks very much. We know you'll be watching when that vote comes in tonight, Blair.
A baby just 6 days old has already had quite the week. Officers blocked off of Mount Holly Highway when her mother started having contractions on the side of the road. Now, she talked with our Ken Lemon about that day and those officers' quick actions.
And she arrived 15 days early. The family started from their home in Mount Holly, got about 9 minutes into their trip when they got right about here, Highway 273 near I-85, and they realized the baby is coming. She is just 6 days old, but her mother already sees her as larger than life.
She's a whale.
Zarini Kuwechlizzetto was in a hurry to see her parents. Saturday morning, her father stopped here along Highway 273, realizing his girl was coming faster than he could drive. He called 911, but there was a language barrier. The conversation was moving slowly. He saw Mount Holly police officers driving by.
Thanks God, because, I don't know what to do.
Those officers snapped into action, blocking traffic on the highway. Then some jumped in the family's SUV and helped Mom push.
Reaction is so quickly, right?
Yeah.
But it took another 10 minutes to deliver the baby. The child was born seconds before firefighters arrived, minutes before the first ambulance, but just in time for Mother's Day.
She's so beautiful and healthy and strong.
Those are 3 of the 4 officers visiting the family a few days later. The family says she is here, little booties and a bow, because of 4 officers who stepped up to help. The family considers them a godsend.
I feel so happy and I'm so thankful for them.
They had a doctor's appointment just a few minutes before I talked to them. The doctor told them their child is doing great. Back to you.